All right, so today we're gonna go over a cardiovascular examination. We are just gonna explain to our patients what we'll be doing, look, listen, and feel. So make sure to get permission, male and female. We'll ask questions like any pain, do they have any history of heart problems, do they ever get tired quicker than their teammates? We'll go with that. Also, while you're doing that, like I said, we'll look for any deformities, any bruising. We can also check vitals while we're doing that. So we'll just go over a few of them really quick while we're going through everything. But before we do that, let's go over this really quick. We have two sides to this. We have what's called our diaphragm and the bell. Diaphragm is for the high pitch, bell is for the low pitch. And then you don't just turn it, you usually have a notch, and wherever that's on is what it'll be. So let's keep it on diaphragm for right now. Again, we'll ask history questions and see what brought them in. Before that, we'll look at other vitals of them. So if you get your hand out for me, please. We'll just hold on. Let's just check their fingernails. Hold it for like 5 seconds and then let go. It should come back within 2 seconds, the coloring. We'll also could check, like I said, we'll check radial, brachial nerves. So we'll roll over. So we're just gonna check. Remember to use your fingers, don't use your thumb because of the pulse. So I'll just do the one and then I'll do bilateral too. So we'll check both of them. Then also we'll check brachial too. Inside there. You can do radial too if you wanted to go up there. Let's also check the carotid artery too. So we'll just push down on there and just feel. Remember to count. Find the pulse. You want to see also any deformities. Triangle area also, very big red flag. We are going to check 4 compartments on their chest. So again, you're going to need to explain to them if you're a male and you have a female athlete. It's best to have someone in there. In fact, you should have someone in that room with you while you're doing it. Explain to them on yourself first where you're going to be checking 4 spots, 1, 2, 3, and 4. Aorta, pulmonary, tricuspid, and what is it? The mitral valve. We're going to check them all first with diaphragm and then check them again with the bell. So we'll just quickly go over those spots. So when it comes to your aorta valve, it'll be in the second interstitial, both of them. And then when it comes to your tricuspid, it'll be 4th or 5th. And then your mitral will be intercostal. So we're just going to quickly go through, just really quick. So sternum, go to the left like we said every second. Just listen and have it be quiet. Then we're going to go pulmonary. Tricuspid. And then you're going to have your athlete. So you're going to take your breast and then just push to the side so you can get inside there. Again, be professional. And since we're here already, I'm just going to quickly switch over to the bell. So the athlete doesn't have to do it again, or your patient. Okay, then we'll go down again. Tricuspid. Let's take it up to, okay, you can relax now. We'll go pulmonary. Remember the thumb is what we're listening for. And then that's how you would check that part of your examination. While you're also doing that, let's check their pulse again. Yes, we checked. But let's also just put pulse ox on your athlete. Does it hurt to actually have better? And then do blood pressure too. You know, if you're gonna be thorough, be a thorough AT. Pull it up. Obviously, we won't have this. So I have them pull it up. And then we're just gonna go through the basics. Remember, go so that you can see it. This will be on the artery. So, put that just so I can see that part. Hook it. Remember, tighten it. Then you'll let it go. Put this on. Keep it on the diaphragm while you're doing this. Remember that it needs to stick out in the earpiece so they go inside your ear. So we will tighten this up. So we'll just keep going. And then we'll just go slowly. And then just continue your vitals, depending on the reasoning, but emergency maybe every 5-10 minutes. But if you're just doing a simple check, then just one should be enough unless there's red flags on their pulse rate. And that is it. So thanks for joining me. Next video.